having given probably over 100,000 prescriptions of Unda numbers in the last 15, 20 years, it's like, I got lots of stories. Obviously ones that are sort of stand out are some of the more recent ones. Because I've mentioned Lyme disease, I'll tell you of a 22-year-old young lady who we've been only treating very recently, probably in the last 2 or 3 months. So she came to us 3 months ago, pretty much incapacitated. Her problems from her memory started at least 10 years previous, where she became pretty much totally incapacitated. Chronic migraine headaches, chronic fatigue. She had mononucleosis that sort of lasted forever. And so she went to doctor after doctor, who basically said, well, as far as we can tell, we don't see anything wrong with you. So she was diagnosed with chronic fatigue syndrome. They had no treatment for her. They said, oh, it'll get better in time, so don't worry about it. She only started her menstrual cycle when she was 16, so which is certainly much later than you'd normally expect that to happen. And then when she did start, she had pretty significant dysmenorrhea, lots of cramping and lots of discomfort associated with that. Migraine headaches that would last not just a day or two, but up to a week. She went on probably for 8 years with multiple doctors who, in fact, she went to a neurologist once because of the migraines, and the neurologist did MRIs and did a number of studies and said, there's nothing wrong with your daughter. Tell her to grow up and just go home, and there's nothing wrong with her. In the meantime, she pretty much could not get out of bed. She was sleeping about 18 hours a day. She went to a specialist in New York City who was a Lyme specialist and said, even though her test did not come back positive, they said, well, you have all the symptoms and you don't have anything else, so you must have Lyme disease, which is quite unfortunately typical of many people when you don't know what to call it. We're now calling everything Lyme disease, per se. So they started treating her for Lyme disease, and she was doing IV antibiotics, and she just kept changing the IV antibiotics until she reacted very poorly. Then they did oral antibiotics, and then she reacted very poorly. So she went back on IV antibiotics, and by the time they put the third one in, she ended up having a seizure. So they said, well, we'll give you seizure medications while we're doing the antibiotics, just in case you have another seizure. So her parents said, okay, I think that's enough of this approach. She came to our clinic in Scottsdale. She was there for 2.5 weeks. The other chronic symptom that she also had, I forgot, was chronic nausea. She basically couldn't eat. She would wake up in the morning and have this such an upset. She didn't want to eat because it just made her feel worse. She was able to get enough calories to basically not lose weight, but certainly not gain weight, which is, of course, part of her ongoing issues for what was going on. The other symptom that she had as a 20-year-old, she was having night sweats. She had night sweats to the point where she would have to get up a couple of times a night and take a shower, and she would still soak the sheets. She'd have to change her bed every night and take a couple of showers just to be able to get through the night, which is, of course, contributed to part of her fatigue. So she was at our clinic for about 2.5 weeks. We did all the types of evaluations that I was sort of talking about, and we started her on Unda numbers, chemotherapies, oligo elements. I started her on the cycling of the 4 different homeopathic hormones to try and get her menstrual cycle more in line. And then with that, I sent her home. And I talked to her 3.5 weeks later, and the first thing she said to me, she said, I'm in shock. And I didn't know how to take that. She said, I'm in shock in a good way. In that 3.5 weeks, I've had more improvement than I've had in over 10 years of many doctors, many different types of treatments. I said, okay, we've got the process started. So I updated her program. I spoke to her a month later, and she said, I pretty much am back to a normal 22-year-old. She said, I have not felt like this for over 10 years. This is really 2.5 weeks in our clinic and 2 months of drainage remedies. She is, and her parents are more than ecstatic about what it is. She's going to be able to go back to college again. She's not been able to complete. She's never been able to sort of go through a semester. She really feels, and one of her challenges is, I tell these people this, Don't get too enthused because we still have to build your reserves up. We still have a lot of healing to do. We have a lot of repair to do because, unfortunately, of the, I will say, the 10 years of therapies that you did have. So this is, I won't say that she's the exception. This is kind of what I have come to expect with patients who do this. And whether we're treating that type of a patient or a patient that I'm going to be presenting at a cancer conference in Phoenix in November, was a patient who I started seeing in 1998 who had a type of cancer, mantle cell lymphoma, that for the most part has about a 2-year life expectancy. So after he was still living, about 8 years later, his oncologist said, you are the oldest living surviving person that's known in the world. And he did do so-called conventional treatment per se, but even with that, he was told that even with the treatment, the expectation would be that you would probably live about 2 years. And then his last treatment, which was probably in 2002 or so, was a specific type of medication, and the oncologist said, we generally have to repeat this every 4 to 6 weeks just to buy you time. He's never repeated it. And his numbers have always gone into normal. He's never had any type of recurrence. So he's one of these, he's this miracle person. It's like, oh, I wonder how that happened. So, that's the, and can I say every cancer patient is like that? Absolutely not. I mean, do we get the right individualized treatment? I'd say absolutely. If we're able to do that in some patients for different reasons, as much as we want to individualize it, we whether time is a factor or economics is a factor, we can't quite get it, but we're certainly moving in that direction. Without doubt, any patient, no matter what they're come for, the minimum that we get out of it is improved quality of life. That we always get. And that is what I've always come to expect, almost no matter what the patient presents with.